Hi there, it is Dr. Alan Jenks from StopYourBackPain.com. It is Sunday evening here for me, and I'm about to interview a good friend and colleague, Dr. Philip Snell. I had always had an idea of developing a website to help friends and family get rid of and deal with their low back pain, as it was always hard via email or on Skype to try and coach somebody in sort of the detailed and aspects of low back pain. Well, before I knew it, Dr. Philip Snell had done the same thing, and he's put together a really great site that takes you from point one to identifying what type of back pain you have and whether or not this site can help you, to a whole plan of action in how you do step-by-step things in order to get rid of your back pain. I hope you enjoyed the interview. It was fun for me to do it. I haven't spoken to Dr. Snell in years. We graduated together back at University of Western States, and it was great to get back online with him and just talk about aspects of low back pain and how his site can really benefit you. So I hope you enjoy this, and we'll see you inside the community at fixyourownback.com. First, I just want to welcome you, Philip, and thank you very much for taking the time to be on here with me. And I appreciate we're all busy, but it's just nice to have like a little visual for people to really put the text and the information together. So thank you.
You're welcome. It's nice to see you again, Alan. It's been a long time.
It has been, yeah. It's amazing how the time just kind of runs away on you. But I thought what was unique for me about doing this video is that I've always had this idea about creating a website for essentially friends and family, you know, where you get all these questions about, oh, what should I do about this? What should I do about this? And I mean, you might be thousands of kilometers away, and I mean, all you can really do is coach them over the phone or via email. So I always had this idea, and then, funny enough, there's this guy that creates a website who just happens to be, a friend and a chiropractic school classmate. And so I thought this would be a really great idea just to get on together to show people that, we're just two normal guys who happen to be chiropractors, and to discuss really how this Fix Your Own Back can help you. So that was kind of the begin phase of this. So I just want to start from there. And I guess my first question for you is really just, what was the inspiration to create the website?
I say this with a little bit of chagrin, but it's somewhat of a narcissistic driver that really put me into the space on this. Now, what I mean by that is the first year I was in practice, Alan, I herniated a disc in my back, and it was the most exquisite pain that I'd experienced before with any kind of musculoskeletal injury. And the interesting thing that I found was that I went back to some of the people that I held dear in our educational process, some of our professors and such, and I tried to get some help, both from chiropractic and later from acupuncture and a variety of other quote-unquote alternative therapies, and I really wasn't getting any better. I'd be okay for a bit of time, and then I'd have a flare-up and nastiness and a back spasm that would lay me down for 3 to 5 days. So to make the story a little shorter, basically I got, you recall that we were both sort of eggheads and we spent a lot of time in the books. I got really interested in this, and I figured I was going to bootstrap this. I'm not going to be a purported expert on the spine and not be able to take care of my own back. The world has very little use for a chiropractor with a bad back. So I actually got in touch with some of the researchers that were really starting to publish then. One of your countrymen, Stuart McGill, was a big a big influence for me, and I actually studied a bit with McGill, read all of his literature, and started to apply it, and my back started to get better. And over the next 3 to 4 years, I steadily added other aspects of rehab and research that I had become aware of as time went on, and I steadily got better and better. My episodes of back pain became less and less. So I decided that I would start to implement that for my patients, and that sort of happened naturally over time. And there were several months later, excuse me, actually several years later, that I had one particular patient that sort of hammered this home. I write about him on the blog that's associated with the site. It's a blog post called For the Sake of Carl. Carl's not his real name, but for the purposes of the conversation, we'll call him Carl. But Carl was a big burly guy that lifted weights quite a bit, and that was a lot of his passion and where he found his identity. And he had been sort of sidelined for several years with this kind of back pain. And he came to see me literally with a 9 out of 10 pain, could barely get out of the waiting room and into the treatment room. After about 45 minutes to an hour of working with him, not only was he up and getting around well, but I had him deadlifting weight off of the floor without pain. And he sat down, and I say deadlift, and some people get worried about that when they hear it. You know, I didn't have this guy loaded up with several hundred pounds. We're talking about functional weight, like 30 to 40 pounds, picking up your child, picking up a bag of groceries, picking up a bag of dog food or something. So he sat down and sort of surprised me. He got quiet for a moment, and he looked down and he looked back up, and he was crying. And here was this grown, burly man weeping in front of me, and I was kind of taken aback. And I said, you know, Carl, what's up, man? Are you okay? Are you hurting? And he just shook his head. And this always kind of catches me up. But he looked at me and he said, where in the hell was I supposed to learn this? And, you know, I really didn't have an answer for him because I knew where he was coming from. I'd been through that fire. I knew what it was like. Right. And he just didn't know where to go for that information that I knew how to go and get. So I decided at that point that I was going to put the site together, and Fix Your Own Back seemed to be a natural name for it, since that is essentially what it is. And it mirrors what we do in our clinical process that we'll be expanding on in the next several years as well. Right. But it's essentially everything but our hands that we use in clinic to successfully treat disc herniation in the lumbar spine.
Yeah, that's great. I mean, it's sort of, I'm assuming that a lot of the people that'll be, listening to this right now are kind of skeptical because they've been to chiropractors, they've been to physios, they've possibly been on other online sites to look at stuff. So they're like, yeah, what is going to be different about this? And I think really what grabs me about the story is that, the whole process really came from a problem that you had. And it just so happened that problem was something that you spent 4 years learning how to try and fix. And lo and behold, sometimes we don't have, or we don't get taught the tools necessary to be able to do that. And I still to this day get blown away by the fact that here we were 3 years, 365 days a year. We didn't take a break off for summer or anything. We went right through for 3 years, learned a whole lot, became very knowledgeable. But often, the patients that show up in our clinic are the ones that were like, I have no idea how I'm going to do this. And that's what I love about this process and about the website is that you've sort of, you've kind of went back to the basics and, just said, okay, how can we do this?
Yeah, the interesting thing is that among all back pain, chiros do a really good job of managing most relatively innocuous back pain. But the most severe and disabling kind of back pain, and that really makes people go out looking for help, typically involves the disc. And when it gets to that point, especially if a person has sciatica or what we call radiculopathy as a result of that disc injury, frequently the standard things that we learn in chiropractic school really don't treat that very well. So what I saw was this relatively underserved, terribly confused, understandably confused subset of people with back pain that needed some clarity and what you might call a plan. It's actually what I call it on the site. Right. A friend of mine used to be fond of saying, plan the work and work the plan. Right. So what I figured with this stuff is, you can go online at a variety of different sites, YouTube and such, and you can find a bunch of different videos of information and stuff that you should do. To my mind, treating this is very much like learning to become a very good cook or a chef.
Right.
To carry the analogy out, if I want to bake a cake, I can take some flour, some sugar, some milk, some eggs, and some variety of other ingredients. I put them on my countertop and turn the oven on. I still don't have a cake. Likewise, I can take the eggs and throw them at the wall, spill the flour on the floor, turn the oven up a little higher. I still don't have a cake. Likewise, I can throw all of the eggs, the sugar, the flour, and everything all together, put it in a pan, not stir it right, put it in the oven. I still don't have a cake. You follow. You can do a lot of these piecemeal things, and you might get something that kind of works, but really to treat and to treat your acute back pain and to actually heal the disc, you need a process of clear action that you need to take that's chronological.
Right.
You do some things now, you do some things later, and there's an ordering process that works well for this.
Right.
So that's what the site embodies.
Like, what would be, so people that are watching this now, what would be sort of your typical symptoms? What would be, the process or the plan that they're going to go through on Fix Your Own Back?
Right.
What would be sort of a starting base? Who would this be for that off the bat, okay, if you have this, you got to check this site out?
Right. There's a few classics that people show up in our clinic with in their history. And people that, and those people are sort of mirror images of the people online that are going to be coming to the site. So if you've had back pain that is really severe and disabling to the point that your back has locked up on you in the past, when you bend down, you pick something up, even something innocuous, getting something out of the dishwasher, picking a pen up off the floor, and your back seizes and locks and you can't stand up straight, there's a really good chance that you've got a disc issue that's latent that needs to be addressed. Similarly, if you've had a history of sciatica, then the site's for you. If you've had an MRI that suggested you had a disc bulge or a disc herniation, that's another good call. Prior history of a lifting injury is a good one. Back pain that is typically worse in the morning when you first get up, or worse after you've been sitting for a prolonged period of time, rolling over in bed, getting in and out of a car. All of those things, if they're painful for you, then the likelihood is the pattern of back pain that you've got is one that this site will address really, 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 really well.
Okay.
So there are other flavors of back pain of course out there. Many of those those subgroups will respond relatively well to this. But the nice thing about the site is if you get in and you go through the initial screening process and you find that the site actually, that the information you receive is actually making you feel better, there's a good chance that the ongoing information will continue to make you feel better. If it doesn't make you feel better, then the site's not for you, and you can easily just discontinue your membership with very little problem there.
Right. So talk about this initial screening test, which I really like. So they get to the site.
Mm-hmm. It's mostly a derivation of Robin McKenzie's work. We just exposed the person to some prolonged and repetitive extension in their lower back. Extension is bending backwards, so laying down with propped up on your elbows for a bit, and just see how the back feels after that. If it feels good, then you're on the right track. If it doesn't feel so good, there's some troubleshooting that might need to be done before you can completely write that off. But if it feels good, great, the site's yours. It should make you feel much, much better very shortly, and then over the longer term, actually continue to reduce the episodes of flare-up and the back pain, and give the body the opportunity to actually heal the disc. And that's important too. On that, a lot of people hear disc injury, and they get really alarmed. They get really worried. They think about family members or friends that have had a disc herniation and they needed surgery, or or they were never really the same after that. It's important that listeners understand that discs are like anything else in the human body. They will heal once they're injured. The trick is in learning what movements and activities tend to pull the scab off, if you will, while the body is trying to knit that and heal it. Right. If you put the brakes on that, do more of the things that actually foster health in the disc, then the disc will be absolutely fine. I'm living proof of that. I'm, going on 11 or 12 years now since my back issue there, and I've had, I think, one episode in 10 years, and that was trying to get a personal record on a deadlift. So that's lifting, close to 300 pounds for my narrow behind, and that trying to move that kind of weight was, just a blown lift. And I had one day of slight discomfort, and I was fine after that. Okay. That is very similar to what we see in our patients in the clinic on an ongoing basis, and we hear that as well in the feedback we get from the site.
Okay. So now they've decided to sign up to the membership and they've logged in. What's sort of the plan that you have within the site? So once they log in, what is sort of the process there, sort of in a general sense?
Well, the site is laid out somewhat like a college textbook. There are chapters in it, and each one of the chapters has, just like you would expect if you were opening up a college textbook, learning objectives. So you have learning objectives for that chapter of material, some written text on each one of those chapters, and then a bunch of videos, a channel of videos associated with that particular chapter to help them meet those goals. And then again, just like the college textbook model, at the end of the chapter, there's an exit test. So at the end of the chapter, after you've done that exercise for a period of time, you can do the exit test and see if you're able to pass it. And if you are, then you're green light to go to the next chapter and try to achieve the next objective. Okay. And while all of this is going on, there's backup with emails that appear sequentially in their inbox that help to answer common questions that people might have. And if those questions if they aren't answered well enough there, we're also available on the online forum, and they can get direct attention and answers to their questions with that too. Cool.
That's great. I think that pretty much covers it for me. Do you have anything else you want to add that I may not have thought of, or it's pretty clear to me.
There's there are certain, I guess, in an online world, there's a concept of something called an avatar, right? Of the ideal person that you're trying to target. And I thought about the people that the Fix Your Own Back site will be most helpful for. And they are essentially mirrors of the people that we see in clinic. And those somewhat stereotypical patients, among them are retirees or ex-military that are a little older, and they've just assumed that their back pain is something that is always going to be there. Another stereotypical patient might be single mothers that are trying to manage childcare. They're concerned about whether or not they're actually going to be able to take care of their child and or earn a living because of their back pain. And similarly with young fathers oftentimes will have a desire. They'll kind of look down the pike and it's like, my gosh, am I ever going to be able, when my child hits adolescence, am I going to be able to go out and play with him? Am I going to be able to go out and shoot hoops with him, or throw a baseball with him, or play a game of tag football or something? Yeah. Another common stereotypical patient that we see are CrossFitters. Right. CrossFit has a lot of positives for it, but it also has some detriments. And unfortunately, some of those detriments often lead a person to injuring their back, specifically injuring their disc. And there's elements on the site that kind of appeal to that particular person as well.
Right. And I'll add one more avatar, and that's the Dutch greenhouse workers who work 80 hours a week.
Nice. Yep. Yep. That's certainly would fall into that category too.
Yeah. Cool. Well, I thank you for taking the time to be here with me. I appreciate it. It was great to catch up again, and I've always, I always appreciate your writing, I've always felt that right from day one. Even when we were in school, I find that I get caught up in a lot of gadgets and fancy things and fancy techniques and fancy ways to look at the body. And just me personally, I find myself being biased quite often. And I often find that whenever I read something from you, you're able to bring me back down to a level playing field and really look at the issue from just a neutral perspective, and is this the right way to do things. So I appreciate everything that you've done so far, and hopefully as people click through the link and go to the website and sign up, they'll get a lot of benefit from this, because I know you've spent a lot of time and energy, and I know it works because I use a lot of these concepts in practice that I've learned from you. So I appreciate it, and thank you for that.
Oh, Alan, it's very kind of you. I appreciate those sentiments. And you're right. There's a lot of work that's gone into this, and trying to keep it even keeled and trying to create a clear, organized path for people to be able to follow, to be able to get out of their misery. So yeah. I appreciate that, man.
Great. So if you're, this is the end of the video. If you just go underneath this video, you'll see a little bit of text just to give you a little bit more introduction, and then a big link to click through to find out more. And Philip will take you through the rest of it through his website at fixyourownback.com. And we hope to see you inside in the community. Thank you very much.